Hey Rachel, my name is Carson. I'm the social worker that's going to be working with you today. I'm really glad you're here. It's nice to meet you. So can you tell me a little bit about what's going on? What brought you here today?
Yeah. Right now I'm currently a graduate student. I'm about to finish my master's degree. But I thought it was probably a good time to go ahead and seek counseling just because even though I am a graduate student, like I also juggle being married and being a mom, and I'm a CPS worker. I investigate, and I also work at a therapy office doing intakes on the weekends. I mean, it's probably pretty easy to tell that, between all that stuff, I'm super busy. And with that being said, my husband, he works 7 days a week. Um, there's just been a lot of things going on. Like my son, he's fallen out of his bedtime routine and he's staying up till like 8:30, 9, 10 o'clock. I have homework to do. And then me and my husband were just like juggling all this stuff, and it's something that I wanted to talk to you about. I label it as being like in a roommate phase, because yeah, we're married, but it's just like like we just live two separate lives, and I'm just nervous that this is going to cause like me and my husband to like fall apart, and I don't want a divorce. Like I don't feel like I need that or that we need that. I just don't want to continue to live these two separate lives and not have a healthy marriage. Like I still want to have like that friendship and like going out and doing stuff together, but it's just like right now we just have a lot going on. I just don't know how to really balance that and get out of this, like essentially this roommate phase.
Well, thank you for sharing that with me. It's impressive that you're able to balance all that. It sounds like you have a lot on your plate, so it's understandable. I can see how y'all maybe kind of communication might be struggling right now. Do you mind giving me like an example or two of what the communication looks like between y'all on a daily basis?
Yeah. So he usually goes to work anywhere between 1 o'clock in the morning and 4 o'clock in the morning. And I don't get up till like 6:30 or 7 to go to work. So he'll get up and go to work, and obviously he don't wake me up or the baby. And then he works, and then I go to work too, and I get off at 4:30. I'm just really busy because, like I said before, I'm an investigator for Child Protective Services. So I just never know what I'm going to get thrown into that day. And I don't have a lot of time just to text people. So we don't really talk. I mean, like today, he didn't get home till almost 7 o'clock. So I was home with the baby for a few hours, but he came home and then he grabbed Anson and then they went and played, and then I cooked, and then I don't even really know if we said really anything to each other. He Anson, we've put Anson more in a bedtime routine. He's going to bed at 7:30. He got Anson in his pajamas. He changed his diaper, put him in his pajamas, gave him his bottle, and they went to bed. We didn't talk about anything, and that's like a normal everyday thing for us.
Yeah. Well, I can see how that could be frustrating. And it sounds like to me like you obviously care a lot about your relationship with your husband. You love him a lot. So I want to make sure I'm getting this right. It sounds like you have a desire for like a greater closeness with your husband. Is that correct?
Yeah, yeah, that's correct.
And you may be having like a little anxiety over y'all's relationship, kind of not communicating as much as you used to just due to being so busy.
Yes, yeah.
Okay, well, this is normal in some marriages, especially when you're so busy. So it's not anything that we can't like fix or give you some skills to help with. So there is a skill called assertiveness training. If you want to hear more about it, I'd love to explain it to you if you think this is something you want to work on.
Yeah, that's fine. Yeah, I'm open to try anything. That's why I came. I just don't know what to do.
So assertiveness training, this is a good method for people that are struggling with like communication or anxiety related to certain relationships. And specifically, the technique that I would want to use with you for you to use with your husband is called communication skills training. So with this, you would be able to practice like healthy communication skills. We could do role plays. And further on, I could give you homework that would help you to kind of challenge yourself and your husband and reinforce some attempts to be more assertive and just learn healthier communication skills. And it would also
Mhm.
help you work on active listening and constructive negotiation in the relationship. So it sounds like you're both busy. So I think it would be helpful for you both to kind of negotiate like a schedule together, something that would work for both of you to make time for each other. So if this is something you'd be interested in, we could start working on this in future sessions. I think it'd be helpful for y'all because it would just teach you how to like effectively respond to each other and also how to express your emotions too. Because if you're not seeing your husband as much, it might be difficult for you to really tell him how you're feeling and him to tell you how he's feeling too. So is this something you might be interested in?
Yeah, yeah, that sounds great.
Okay, that sounds good. And once we get further on, we'll start doing some more homework exercises, and this will be stuff that you can carry on with you later in life, whether it's in your marriage with your husband or a relationship with someone else. Will teach you skills that you can utilize throughout your life.
Okay.
Okay, well that sounds good. I appreciate everything you shared with me today, and we'll get to work on this in future sessions. Okay, Rachel?
Okay. All right. Thank you.
Have a good one.